Yes, I'm very pleased with the progress the SDU has made in relation to tackling what was the biggest issue of the day. 569 people on trolleys around this country on a single day in January 2 years ago. I said at the time we wouldn't see that again. A lot of people swallowed very hard when they heard me say that. But the SDU was a critical component in addressing this issue. I'm not interested in spin, I'm interested in reality. The reality is that we've had a really serious problem, but we can't deal with that problem of the emergency department in isolation. So if we're going to fix what's happening in the emergency department, we must fix what's happening in the hospital itself. We must fix what's happening in the community in terms of long-term care and home care packages. And we must fix primary care so that the flow of patients into the hospital is reduced as we have earlier intervention and prevention in the community. So what the SDU has done in conjunction with the front line and the clinical programs is bring about a transparency so that we have the information that allows us to track what's happening 3 times a day, which has allowed us to develop a prediction ability. So now we can know today what's likely to happen tomorrow morning and take action to correct it. I've often said we have some of the best doctors in the world, some of the best nurses in the world, and indeed some of the best managers in the world are Irish. So how in the name of God is it we haven't had one of the best health services in the world? Well, it's because the system has just evolved instead of been planned, and that's what we're doing now. We're changing the system to allow people deliver of the excellence they were trained to give and want to give. There's 20,000 less people were on trolleys last year than there were the year before. That's a reduction of 24%. There was a reduction in inpatient waiting times from 9 months of nearly 99%. To me, it's extraordinary that we've never had before now an accurate count of how many people were waiting for an outpatient's appointment. Previous governments just didn't want to know. Well, I want to know so we can deal with it. The real scandal, of course, is that there's over 16,000 people waiting longer than 4 years for an outpatient's appointment. And to me, that's a disgrace in a modern country. We're going to address that, and my undertaking is that by the end of this year, nobody will be waiting longer than 12 months for an outpatient's appointment. We have a very exciting IT development where we can now monitor each hospital's outpatient waiting time by speciality. That's the level of transparency we need to bring the sort of accountability we need to ensure that people have been treated fairly. We will have that internally, and we will make it available on the internet externally after a period of months. I want to give everybody a chance to realise where they are on the scale of things, and if somebody's got a waiting list that's extra long, we'll go down and give that person the help to sort out the problem. We should be focused on patient outcomes, not on inputs, not how many doctors, how many nurses, how many billion, but what are the outcomes for patients? How long did they have to wait? How quickly were they seen? How many had to be readmitted because they weren't treated properly in the first instance? We have good measures of outcomes in hospitals, but we don't have them in primary care. And I personally, as a GP, for many years believed that being able to see your doctor within 24 hours must improve outcomes, but I can't prove it. So I want to be able to measure outcomes in general practice too. And then we'll know the things that GPs are doing that improve outcomes, and we can get them to focus on them and perhaps focus less on the areas that are of more dubious benefit.